What's up, guys? Welcome back. So today we're going to finish our videos. We started with the EMR, moved to EMT and advanced EMT. Now we're going to get to the highest level that you can find on an ambulance, which is going to be a paramedic. Okay. So first, short review. Okay. So we started with the EMRs. We've got them listed here. So they do about 48 hours of classroom time, and then they do 16 hours of clinical. Most of those clinical hours are going to be in a lab with simulated patients, but they do sometimes go right out on an ambulance just to get patient contacts. It depends on what school you go to. Okay. And then we're going to go on to the EMT. So they have 152 hours of classroom hours, and then they have about 48 clinical hours. They'll do usually a mixture of, they'll do 24 hours on an ambulance, and then they'll do 24 hours in an ER, just so they can see patients, learn how to do what they need to do. Okay. And as we kind of discussed in the last videos, those two first providers are considered BLS, or basic life support. So their main focus is going to be on trauma patients. Okay. Once we get to the advanced providers like the advanced EMT and the paramedic that we're going to talk about today, they're considered ALS, or advanced life support. And the biggest difference is we start to learn more about true medical emergencies. Okay. So like COPD, heart attacks, strokes, stuff like that. So with advanced EMTs, there's quite a big jump. Okay, they go to 200 to 300 hours of classroom time, and then they do 96 hours of clinical. A majority of that's going to be on an ambulance, but they're also still going to do some in operating rooms, kind of like a paramedic. We'll talk about that here in a minute, for intubation purposes. They also do it in the ER for IV skills and stuff like that. So they do about 96 hours of that. But as we get over here and we start to talk about the paramedic, what we're going to talk about today, you see a massive jump. Okay, so here we went from 200 to 300 classroom hours for an advanced EMT to over 1,200 for a paramedic. Okay, that's about a year and a half to 2 hour or 2 year program. So they go to class a lot. Okay. Um, for the 2 year degree, it's actually a degree. It's associates in emergency medicine or paramedicine. There's also another option that you can go to a VOTEC or something like that, or a technology center, and you'll get the same thing. You'll learn the same things as somebody that's going to a 2 year program. You just don't have the degree with it. Okay, you'll get a certificate, and it's usually about a year long. There's no difference in curriculum. They learn the same thing. One paramedic's not better than the other just because they have an associate's degree. Okay, you're learning the same thing, just one has a degree, the other one does not have a degree. They also do, that's not including over 600 hours of clinical hours. Okay, so they do clinical rotations on an ambulance, in the ER. They also do it in the ICU for both adults and pediatrics. We learn about children just as much as we do adults, because we never know if we're going to run an adult patient or a child patient or something in between. Okay, so we learn about all age groups when we go to school. Okay, so we also do some RT, some respiratory therapy clinicals. That's for those patients where we might have to put them on a CPAP, BiPAP, something like that. And we'll make a video about what those are. Also, intubation. We learn about that in the operating room mainly. Those people that come in for procedures, oftentimes there's probably a paramedic student or something like that in there, and they will actually be the ones that are intubating you for your procedure, because it's a controlled environment and it's a good way for us to learn how to use those skills. So we do a lot in the operating room. There's some others. Some places we do dialysis clinicals. And so there's a lot of clinicals that we do to learn everything we can. That's also not including usually another 500 hours of what we call an internship. Okay, so that's where we find a paramedic or somebody we really want to learn from, and we are stuck with that person for 2 to 3 to 4 months, depending how many shifts we do with them. And that's just, we like their mannerisms, we like how they work, we like how they treat the scene, how they treat their patients, and we really want to learn from them. So we stick with them for a couple months, and they teach us all about how to run our own scene, how to treat our patients, and how to run the ambulance. So There's a lot of clinical hours that go into it. Um, I'm sure you're wondering, why is there such a big jump? We went from 200 to 300 classroom hours here on the advanced EMT to almost 1,200 hours. Okay, and the biggest difference is we're talking about ALS providers, how they learn about more medical issues, true medical issues, so heart attacks, strokes, stuff like that. This is the big reason why paramedics go to school for so long. It's pharmacology, okay? It's the study of medication and how it works inside the human body or a living organism, okay? And these are just some of the medications we carry, okay? It doesn't even truly cover what we all have on the ambulance, okay? So we have things like albuterol and Atrovent. If you have asthma or COPD, you're probably used to hearing that stuff. That's going to help your alveoli and stuff in your lungs, going to help open them up so you can breathe a little bit easier, okay? Adenosine, epinephrine, Levophed, those are all cardiac medications that we can use. Adenosine, if your heart's beating too fast, we can give that medication that slows it down. Epinephrine, if your heart's not beating fast enough, we can give that. If your blood pressure's too low, we can give you Levophed. That's going to bring your blood pressure up. Atropine, it's kind of the opposite of adenosine. Okay, atropine is if your heart rate's too low, we can give you atropine, and it should bring it up. Okay, and then we have ondansetron. It's a weird word, but I'm sure you've actually heard of this medication. It's better known as Zofran. Okay, um, you're going to get that if you've had surgery recently, or if you've ever had surgery, you've probably had Zofran. It helps with nausea and vomiting. They give it a lot before surgery and after surgery to help with the pain and help with the nausea and vomiting that comes with it. These medications here, these are specifically used for a special procedure that paramedics can do in the back of an ambulance, okay? Which we'll talk about in another video. I just wanted them kind of down here by themselves so we knew they're kind of major medications that we carry on an ambulance, okay? So starting with midazolam, it's actually a narcotic, okay? We carry narcotics on the ambulances. We carry pain medications that are Schedule 1 narcotics. We also have midazolam. It's also known as Versed. We also have rocuronium, succinylcholine, and vecuronium. Okay, these are all going to be used for a special procedure we call RSI, or rapid sequence intubation. And like I said, we'll make a whole video over that. That's a video in itself. Okay, so just today, I wanted you to know that these are some of the special medications that we carry that paramedics can use to help you. Okay. Thank you guys. If you have any questions, just feel free to reach out. I don't mind explaining stuff a little bit more. But like I said, there's going to be a bunch more videos over what all of these providers, all four of these providers, can truly do for you when you call an ambulance. Okay. Y'all have a good day, and we'll see you next time.